Hello and welcome to the video. Just a quick background about myself and my colleagues. My name is Jason and I'm with Fee and Susie. We are first semester associate's degree nursing students in the San Joaquin Delta College in Stockton, California. We are presenting some information regarding asthma and its effect on the children and communities of the San Joaquin County. Our objectives for this short presentation are to describe asthma and its prevalence, its symptoms, the risk factors, and preventive measures of the community. We are also going to talk about available health resources within San Joaquin County and show how the community will benefit from these. According to the Centers of Disease Control and Prevention, asthma is a disease that can affect your lungs. It is a chronic inflammatory disorder of the airways characterized by episodes of reversible breathing problems due to airway narrowing and obstruction. It causes repeated episodes of wheezing, breathlessness, chest tightness, and nighttime or early morning coughing. Asthma can be controlled by taking medicine and avoiding the triggers that can cause an attack. It is also important to remove the triggers in the environment that can make asthma worse. For those who are not familiar with the area, San Joaquin County is one of the top 6 agricultural regions of California. Its top 5 leading crops are almonds, milk, grapes, walnuts, and cherries.
The prevalence of asthma. The San Joaquin Valley of California has 17% of its children 17 years old and younger diagnosed with asthma, compared to the state 14%. The occurrence of the chronic respiratory disorder causes major interruptions in the life of mostly low-income family, the community of San Joaquin Valley. Children affected by asthma miss school days, which lead to decreased performance in standardized exam and increased incidence of dropped out. Data obtained from emergency department of mostly underserved hospital in the region shows a correlation between the increased incidence of asthma and the impoverished areas, as evidenced by the residential zip code of children discharged after treatment. Risk factor. Residents of the San Joaquin Valley are disproportionately impacted by the environmental factor when it was ranked the ninth most polluted air in the United States by the American Lungs Associations. The San Joaquin County Community Health Assessments describe the deteriorations of air quality in the area associated with the amount of pesticide applied in agriculture. Approximately 8,000 pounds of pesticide were used per square mile in the San Joaquin County, compared to 1,000 pounds per square mile in California. The high incidence of asthma in the youth of the San Joaquin Valley is related to risk factors such as living in an impoverished neighborhood, immigration status, and the inability to get insurance coverage. The lack of effective air monitoring policy in the San Joaquin Valley could be harming the people who live there. A recent study from UCSF Fresno and CSU Fresno found a direct link between air pollution and asthma-related ER visit. The study found what researchers call a linear associations between certain components of air pollution and asthma ER visit. In other words, as air pollution goes up, the likelihood in an asthmatic child's into ER goes up too. The San Joaquin Valley has some of the dirtiest air in the country and high rate of childhood asthma. The culprit are two components of air pollution: ground level ozone and particulate matter. Ground level ozone can have corrosive effects on lungs, decrease lungs functions. Particulate matters are tiny particles like soot. The simple act of breathing carry these particles deep inside the lungs, where they stick and can cause breathing, and heart attack. Adults are at risk as well, but for them, the risk is heart attack. Most particularly matters in the air means more people are going to have heart attack on that day.
Some available health resources in San Joaquin County is the San Joaquin County Public Health Services. Website is www.sjcphs.org. This has information regarding chronic disorders and direction for children's health-related services. The second resource available is the San Joaquin County Office of Education, www.sjcoe.org. This is a tool that provides you with the contact numbers for school nurses who can answer inquiries regarding chronic disorder, case management, health education, and Medi-Cal reimbursements. The third resource in the San Joaquin County is the Community Medical Center, www.communitymedicalcenters.org. This has information on Medi-Cal services and dental care, chronic disease management such as asthma, diabetes, hypertension, health education, and healthcare for homeless information and link. How health resources can benefit the community. Not many people know of the different resources that is available to the community. The resources benefit the community by providing information and access to affordable healthcare for medical, dental, and mental health. There is also information on insurance enrollment for Medi-Cal and Medicare services. There's also information on resources on translation for non-English speaking residents and transportation services. For those who may be homeless, they can find resources on housing and food, and there's also help that can be found in resources in managing chronic life-changing diseases such as hypertension, asthma, or HIV. What I learned and how I will use it in the future. I learned the prevalence of asthma in impoverished San Joaquin community due to the bad air quality and inaccessibility to healthcare. The San Joaquin Valley of California has 17% of its children 17 years old and younger diagnosed with asthma compared to the state's 14%. The occurrence of the chronic respiratory disorder causes major interruptions in the lives of mostly low-income families in the community of San Joaquin Valley. Children affected by asthma miss school days, which can lead to decreased performance in standardized exams, and there is also an increased incidence of dropouts. San Joaquin Valley was ranked number 9 in the most polluted air in the United States by the American Lung Association, which is already a huge risk factor for the residents in the San Joaquin Valley. The deterioration of air quality in the area is associated with the amount of pesticides being applied to agriculture. The high incidence of asthma in the youth of the San Joaquin Valley is related to risk factors such as living in impoverished neighborhoods, immigration status, and inability to get health insurance coverage. The combination of pollutants and poverty are drivers for increased risks in developing asthma among the youth. So preventative measures of early detection and proper maintenance of asthma is very important. School nurses play an important role because they are able to identify children with asthma and will be able to assess for risk factors. After getting diagnosed, case managers can teach proper inhaler use and direct guardians to community clinics and closest emergency departments. Furthermore, it is important in recommending resources, the right resources to the San Joaquin community, such as the community medical centers and the other resources in the previous slides.
In the United States, asthma has been identified by Healthy People 2020 as a chronic obstructive pulmonary disease, or COPD. There are significant public health burdens. Specific methods of detection, intervention, and treatment exist that may reduce this burden and promote health. Currently, more than 25 million people in the United States have asthma. Approximately 14.8 million adults have been diagnosed with COPD, and approximately 12 million people have not yet been diagnosed. Similar to San Joaquin County, The burden of respiratory diseases affects individuals and their families, schools, workplaces, neighborhoods, cities, and states. Because of the cost to the healthcare system, the burden of respiratory diseases also falls on society. It is paid for with tax dollars, higher health insurance rates, and lost productivity. Annual healthcare expenditures for asthma alone are estimated at $20.7 billion. To conclude our presentation, we would like to share the resources that we used as references for our evidence-based presentation on asthma in San Joaquin County. If you find some value in the information that we presented, please hit the like button and please share to your family and friends. Thank you and have a great day.